Question 1. The monitoring system demonstrates a significant and unexpected deterioration in Mr. Harrison's condition, indicating a poor prognosis. You are tasked with informing Mr. Harrison and his family about this development. What is the most appropriate course of action? Option A. Inform Mr. Harrison of the deterioration in a brief, factual manner during a busy ward round to ensure efficiency and minimize prolonged emotional distress. Option B. Present the data from the monitoring system in a detailed technical report to Mr. Harrison and his family, allowing them to interpret the findings themselves. Option C. Inform the family first, asking them to relay the information to Mr. Harrison at their discretion, as they may be better equipped to handle the emotional impact. Option D. Schedule a meeting with Mr. Harrison and his family in a private room, clearly explain the findings from the monitoring system, discuss the implications for his prognosis, allow ample time for questions, and offer emotional support and outline the next steps in his care. Correct answer is D. Schedule a meeting with Mr. Harrison and his family in a private room, clearly explain the findings from the monitoring system, discuss the implications for his prognosis, allow ample time for questions, and offer emotional support and outline the next steps in his care. Explanation. Scenario analysis. This scenario presents a significant professional challenge due to the inherent difficulty of delivering bad news to a patient and their family. The complexity arises from the need to balance honesty and transparency with empathy and support, while navigating potential emotional distress and ensuring the patient's understanding and autonomy. The physician must also consider the impact of the news on the family and their role in the patient's care. Correct approach analysis. The correct approach prioritizes clear, honest, and empathetic communication. It involves preparing for the conversation, choosing an appropriate setting, delivering the news directly but gently, allowing time for questions and emotional processing, and offering support and outlining next steps. This aligns with the General Medical Council, GMC, guidance on good medical practice, which emphasizes clear communication, respect for patient autonomy, and providing compassionate care. Specifically, it upholds the principle of informed consent by ensuring the patient understands their condition and treatment options, and it demonstrates respect for the patient's dignity by delivering difficult news with sensitivity. Incorrect approaches analysis. An approach that delays or avoids delivering the news directly, or that uses overly technical jargon, fails to uphold the GMC's requirement for clear and understandable communication. This can lead to patient confusion, mistrust, and a lack of informed decision-making, potentially violating the principle of patient autonomy. An approach that delivers the news abruptly, without considering the patient's emotional state or providing adequate support, demonstrates a lack of empathy and compassion, which are core tenets of good medical practice. This can cause unnecessary distress and damage the doctor-patient relationship. An approach that focuses solely on the medical facts without acknowledging the emotional impact on the patient and family, or that fails to offer support or discuss future plans, neglects the holistic care expected of medical professionals. This can leave the patient feeling abandoned and unsupported during a critical time. Professional reasoning. Professionals should adopt a structured approach to breaking bad news. This involves preparation, understanding the situation, anticipating questions, establishing rapport, assessing the patient's readiness to receive information, delivering the news in a clear and empathetic manner, exploring the patient's understanding and feelings, and providing support and planning for the future. This framework ensures that communication is patient-centered, respectful, and ethically sound, adhering to the principles of good medical practice as outlined by the GMC. Question 2. The efficiency study reveals a significant increase in patient wait times for routine blood tests at a busy NHS hospital. Considering the physiological factors that can influence blood sample integrity and processing, which of the following investigative approaches is most appropriate for identifying the root cause of these delays? Option A. Immediately increasing the number of phlebotomists to expedite sample collection, without further investigation into the causes of the delays. Option B. Investigating potential physiological reasons for sample degradation or altered viscosity that might impact laboratory processing times, alongside a review of pre-analytical factors such as patient hydration and stress. Option C. Reducing the number of routine blood tests offered during standard appointments to decrease the overall volume of samples requiring processing. Option D. Implementing a subjective prioritization system for blood draws based on the perceived urgency of the patient's condition, as determined by the phlebotomist. The correct answer is B. Investigating potential physiological reasons for sample degradation or altered viscosity that might impact laboratory processing times, alongside a review of pre-analytical factors such as patient hydration and stress. Explanation: the efficiency study reveals a significant increase in patient wait times for routine blood tests at a busy NHS hospital. This scenario is professionally challenging because it directly impacts patient care and satisfaction, potentially leading to delayed diagnosis or treatment initiation. It requires a physician to balance resource allocation, clinical necessity, and patient experience within the constraints of NHS guidelines and the General Medical Council (GMC) principles of good medical practice. Careful judgment is required to identify the root cause and implement effective solutions without compromising patient safety or clinical standards. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based investigation into the physiological factors contributing to the increased wait times. Understanding the physiological basis of blood clotting, sample stability, and the impact of pre-analytical variables, like patient hydration or stress levels affecting blood viscosity, is crucial for identifying potential bottlenecks in the laboratory or phlebotomy process. This approach aligns with the GMC's guidance on providing good medical care, which emphasizes the importance of understanding the underlying science of medicine to ensure effective patient management. It also reflects a commitment to continuous improvement and patient-centered care by seeking to optimize processes that affect patient outcomes. An incorrect approach that focuses solely on increasing phlebotomist staffing without investigating the underlying physiological or logistical issues would be professionally unacceptable. This fails to address the root cause and could lead to inefficient resource allocation, potentially masking deeper problems. It also risks overlooking physiological factors that might influence sample quality or processing time, leading to repeat tests or inaccurate results, which is a failure of the GMC's duty to provide good medical care. Another incorrect approach that involves prioritizing patients based on perceived urgency without a clear, objective clinical protocol would be ethically and regulatorily flawed. This deviates from established NHS protocols for routine blood tests and could lead to bias or inequitable care, violating the GMC's principles of fairness and respect for patients. It also fails to acknowledge that even routine tests can have significant implications if delayed due to unforeseen physiological complications. A further incorrect approach that involves reducing the range of tests offered during routine appointments without consulting laboratory or clinical guidelines would be professionally unsound. This could lead to misdiagnosis or inadequate patient assessment, directly contravening the GMC's expectation that doctors maintain their knowledge and skills and provide appropriate care. It also bypasses essential collaborative decision-making with laboratory services, which are integral to the efficient functioning of the healthcare system. The professional decision-making process for similar situations should involve a multifaceted approach. 1. Identify the problem. Clearly define the issue, e.g., increased wait times. 2. Gather information, collect data on wait times, patient flow, and any reported issues. 3. Investigate root causes. Consider all potential factors including physiological, logistical, and resource-related. 4. Consult relevant guidelines. Refer to NHS protocols, GMC guidance, and any relevant scientific literature. 5. Collaborate with stakeholders. Engage with laboratory staff, phlebotomists, nurses, and other relevant healthcare professionals. 6. Develop and implement solutions. Propose evidence-based interventions. 7. Monitor and evaluate. Track the effectiveness of implemented solutions and make adjustments as needed. 8. Prioritize patient safety and well-being. Ensure all decisions align with ethical and professional standards. Question 3. The audit findings indicate a pattern of inconsistent management of patients presenting with a known anatomical variation of the circle of Willis, specifically a hypoplastic posterior communicating artery, which has been identified on routine imaging. Clinicians are not consistently documenting the implications of this variation for potential future neurological events or adjusting standard pharmacological management for cerebrovascular conditions. What is the most appropriate professional response to ensure patient safety and adherence to best practice guidelines? Option A. Implement a mandatory checklist for all patients with identified circle of Willis variation, prompting consideration of clinical relevance and potential management adjustments, and provide targeted educational sessions on common neurovascular anatomical variations and their clinical significance. Option B. Advise clinicians to rely on their individual clinical judgment and experience when managing patients with this specific anatomical variation, as formal protocols for every rare variation are impractical. Option C. Request that all patients with this identified variation undergo immediate repeat imaging to confirm the initial findings and assess for any associated pathologies. Option D. Encourage clinicians to refer all patients with any identified anatomical variation of the circle of Willis to a specialist neurovascular clinic for long-term follow-up, regardless of their current clinical status. Correct answer is A. Implement a mandatory checklist for all patients with identified circle of Willis variations, prompting consideration of clinical relevance and potential management adjustments, and provide targeted educational sessions on common neurovascular anatomical variations and their clinical significance. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in human anatomy and its direct impact on patient care. A clinician must balance the expectation of standard anatomical knowledge with the reality of individual differences. Failure to recognize and appropriately manage anatomical variations can lead to diagnostic errors, suboptimal treatment, and patient harm. The audit findings highlight a potential gap in the systematic identification and management of such variations, necessitating a review of clinical practice against established professional standards and guidelines. Correct approach analysis. The correct approach involves a systematic and evidence-based method for identifying and managing anatomical variations. This aligns with the General Medical Council (GMC) guidelines for good medical practice, which emphasize the importance of maintaining up-to-date knowledge and skills and acting in the best interests of patients. Specifically, it reflects the principle of providing safe and effective care by acknowledging that anatomical variations are common and can have significant clinical implications. This approach necessitates a thorough patient assessment, consideration of imaging findings in the context of known variations, and consultation with colleagues or specialists when uncertainty exists. It upholds the ethical duty of care and the professional responsibility to ensure patient safety. Incorrect approaches analysis. One incorrect approach involves dismissing the observed anatomical variation as an insignificant anomaly without further investigation. This fails to meet the GMC standards for professional competence and patient safety. It can lead to misdiagnosis or inappropriate treatment if the variation has clinical relevance, such as affecting surgical planning or the interpretation of diagnostic tests. This approach demonstrates a lack of critical appraisal of clinical findings and a potential disregard for patient well-being. Another incorrect approach is to proceed with a standard treatment protocol without considering how the anatomical variation might alter the expected outcome or increase risks. This contravenes the principle of individualized patient care, which is a cornerstone of good medical practice. It can result in iatrogenic complications or a failure to achieve therapeutic goals, thereby breaching the duty of care owed to the patient. A further incorrect approach is to delay or avoid seeking specialist advice when faced with an unusual anatomical variation. This can be interpreted as a failure to recognize the limits of one's own expertise, a key aspect of professional responsibility outlined by the GMC. Such delays can compromise patient safety and lead to suboptimal management, as specialist knowledge may be crucial for accurate diagnosis and appropriate intervention. Professional reasoning. Professionals should adopt a structured approach when encountering anatomical variations. This involves 1. Thoroughly reviewing the patient's history and clinical presentation. 2. Critically evaluating all diagnostic data, including imaging, in light of known anatomical variations. 3. Considering the potential clinical significance of the variation for the specific patient's condition. 4. Consulting with colleagues or specialists when there is any doubt or when the variation has potential implications for management. 5. Documenting the variation and the management plan clearly in the patient's record. This systematic process ensures that patient care is safe, effective, and tailored to individual needs, adhering to professional and ethical obligations. Question 4. Market research demonstrates that a significant proportion of junior doctors find interpreting abdominal imaging challenging, particularly when assessing for acute surgical emergencies. A 65-year-old male presents to the emergency department with sudden onset of severe abdominal pain, rigidity, and signs of peritonitis. An erect chest X-ray is performed, which shows a small amount of free air under the diaphragm. Considering the gross anatomy of the abdominal organs, which of the following interpretations of the free air is most consistent with the clinical presentation and requires urgent surgical review? Option A. Free air within the lumen of the bowel representing normal physiological gas. Option B. Free air in the peritoneal cavity, likely due to recent abdominal trauma. Option C. Free air in the retroperitoneal space, suggestive of a duodenal ulcer complication. Option D. Free air in the subphrenic space, indicating a perforated viscus. The correct answer is D. Free air in the subphrenic space, indicating a perforated viscus. Explanation. This scenario presents a professional challenge due to the inherent responsibility of a medical professional to accurately diagnose and manage patient conditions. Misinterpreting gross anatomical features, particularly in the context of a potentially serious condition like a perforated viscus, can lead to delayed or incorrect treatment, directly impacting patient outcomes and potentially causing harm. The need for precise anatomical knowledge is paramount in distinguishing between normal variations and pathological findings. The correct approach represents best professional practice because it prioritizes accurate anatomical identification and correlation with clinical presentation. This aligns with the fundamental ethical and professional duty of care owed to patients, as mandated by the General Medical Council, GMC, Guidelines for Good Medical Practice. Specifically, it emphasizes the importance of maintaining up-to-date knowledge and skills, applying them effectively in clinical decision-making, and ensuring patient safety through accurate assessment. An incorrect approach that relies on superficial observation without a thorough understanding of anatomical relationships and potential pathological changes would be professionally unacceptable. This could lead to misdiagnosis, inappropriate investigations, or delayed referral, violating the GMC's principles of patient safety and competence. For instance, failing to recognize the significance of free air in the peritoneal cavity, a key indicator of a perforated viscus, due to insufficient anatomical knowledge of the gastrointestinal tract's typical location and integrity, would be a serious lapse. Similarly, attributing findings to normal anatomical variation when they represent pathological displacement or distortion would be a failure in diagnostic acumen. The professional decision-making process in such a situation should involve a systematic approach. 1. Thoroughly review the patient's history and clinical signs. 2. Recall and apply detailed knowledge of the gross anatomy of the relevant organ systems, considering their normal positions, relationships, and potential for pathological alteration. 3. Correlate imaging findings with anatomical knowledge and clinical presentation. 4. Formulate a differential diagnosis based on this integrated assessment. 5. If uncertainty exists, seek further information through additional investigations or consultation with senior colleagues. 6. Prioritize patient safety and timely intervention based on the most likely diagnosis. Question 5. Assessment of a physician's responsibility when considering genetic testing for a patient with a suspected inherited condition, where the test results could have implications for the patient's relatives. Option A. Inform the patient's adult children about the possibility of an inherited condition and recommend they undergo genetic testing without the patient's explicit consent. Option B. Proceed with genetic testing immediately to establish a diagnosis, as the potential health benefits to the patient outweigh the need for consent. Option C. Discuss the potential implications of genetic testing with the patient, explain the process, potential benefits, risks, and the confidentiality of the results, and obtain explicit informed consent before proceeding. Option D. Order genetic testing and use the anonymized results for a research study on the prevalence of the condition without informing the patient about this secondary use. The correct answer is C. Discuss the potential implications of genetic testing with the patient, explain the process, potential benefits, risks, and the confidentiality of the results, and obtain explicit informed consent before proceeding. Explanation. This scenario presents a professional challenge due to the ethical and regulatory implications of genetic information in patient care. It requires a physician to balance the immediate clinical needs of a patient with the long-term implications of genetic testing and the privacy of that information. The General Medical Council, GMC, guidance on consent, confidentiality, and the responsible use of genetic information is paramount. The correct approach represents best professional practice because it prioritizes obtaining informed consent from the patient before proceeding with any genetic testing. This aligns with GMC guidance, which emphasizes that patients have the right to control their own bodies and personal information, including genetic data. Informed consent ensures the patient understands the purpose, potential benefits, risks, and limitations of the genetic test, as well as how the results will be used and stored. This respects patient autonomy and upholds confidentiality. An incorrect approach that proceeds with genetic testing without explicit consent fails to uphold patient autonomy and confidentiality, violating GMC guidelines. This could lead to a breach of trust and potential legal repercussions. Another incorrect approach that discloses genetic information to family members without the patient's consent is a direct breach of confidentiality, a fundamental ethical and legal obligation for medical professionals under GMC regulations. This action undermines the doctor-patient relationship and can have severe personal and social consequences for the patient. A further incorrect approach that uses genetic information for research without explicit consent for that specific purpose also violates ethical principles and GMC guidance on data usage and patient privacy. The professional reasoning process should involve a thorough discussion with the patient about the rationale for genetic testing, its potential implications for their health and that of their relatives, and the strict confidentiality measures in place. The physician must ensure the patient fully comprehends the information provided and has the opportunity to ask questions before making a decision. This process respects patient autonomy and ensures compliance with regulatory requirements. Question 6. Comparative studies suggest that the interpretation of nonspecific symptoms in primary care can be challenging. A 45-year-old patient presents with intermittent fatigue and mild, diffuse abdominal discomfort that has been present for several months. They have no significant past medical history, and their lifestyle is generally healthy. The patient is understandably concerned about these persistent symptoms. What is the most appropriate initial approach to managing this patient, considering the need to identify potential red flags while avoiding unnecessary investigations? Option A. Immediately refer the patient to a gastroenterologist for a comprehensive workup, including endoscopy and advanced imaging, due to the persistent nature of their symptoms. Option B. Conduct a detailed history and physical examination. Explore potential contributing factors including psychosocial aspects, and consider a limited, targeted set of investigations based on the most likely differential diagnoses and any identified risk factors. Option C. Order a broad panel of blood tests, including inflammatory markers, liver function tests, and a full blood count, without further detailed questioning or examination, to rule out a wide range of potential causes. Option D. Reassure the patient that these symptoms are common and likely benign, advise lifestyle modifications, and schedule a follow-up appointment in 6 months if symptoms persist. The correct answer is B. Conduct a detailed history and physical examination, explore potential contributing factors including psychosocial aspects, and consider a limited, targeted set of investigations based on the most likely differential diagnoses and any identified risk factors. Explanation. This scenario presents a professionally challenging situation due to the inherent complexity of identifying subtle red flags in patient presentations, especially when symptoms are nonspecific or mimic common ailments. The challenge lies in balancing the need for thorough investigation with the risk of over-investigation and patient anxiety, all within the framework of GMC guidance and good clinical practice. Careful judgment is required to differentiate between genuine concerns and benign variations. The correct approach represents best professional practice because it prioritizes patient safety and adherence to the GMC's good medical practice guidelines. Specifically, it involves a systematic and evidence-based approach to assessing the patient's symptoms, considering a broad differential diagnosis, and utilizing appropriate investigations based on clinical suspicion and risk factors. This aligns with the ethical duty to act in the patient's best interest and to provide a high standard of care. The emphasis on a structured approach, considering the patient's history, examination findings, and relevant risk factors, is crucial for accurate diagnosis and timely intervention, thereby minimizing potential harm. an incorrect approach that fails to consider the patient's full history and relevant risk factors, or that dismisses concerning symptoms prematurely due to their nonspecific nature, represents a failure to uphold the duty of care. This could lead to delayed diagnosis and treatment, potentially resulting in significant harm to the patient. Such an approach may also contravene GMC guidance on maintaining an up-to-date knowledge base and applying it effectively to patient care. Another incorrect approach might involve ordering a battery of investigations without a clear clinical rationale, driven by anxiety rather than evidence. Seemingly thorough, this can lead to unnecessary patient distress, financial burden, and the risk of incidental findings that may not be clinically significant. This deviates from the principle of proportionate care and efficient use of healthcare resources. A further incorrect approach could be to rely solely on the patient's self-reporting without critically evaluating the context or considering alternative explanations, especially if there are known psychosocial factors that might influence presentation. This neglects the clinician's responsibility to form an independent clinical judgment. The professional decision-making process for similar situations should involve a structured approach. 1. Thorough history-taking, including exploring the nature, duration, and severity of symptoms, as well as any associated factors. 2. Comprehensive physical examination, focusing on relevant systems. 3. Consideration of the patient's demographic, medical history, family history, and lifestyle factors that may represent risk factors. 4. Formulation of a differential diagnosis, ranking possibilities by likelihood. 5. Evidence-based selection of investigations to confirm or refute the most likely diagnoses, prioritizing those that will yield the most useful information with the least risk. 6. Regular review and reassessment of the patient's condition and the diagnostic process. 7. Clear communication with the patient about the diagnostic process, potential diagnoses, and management plan. Question 7. System analysis indicates a 75-year-old patient with a history of chronic kidney disease and hypertension is admitted with dehydration and electrolyte imbalance. The patient, who is alert and oriented, adamantly refuses intravenous fluid resuscitation and electrolyte correction, stating they don't want any more tubes and want to go home. Their current physiological state is significantly impacting their homeostatic mechanisms, posing a risk of further deterioration. As the responsible clinician, what is the most appropriate course of action? Option A. Respect the patient's refusal without further discussion as they are alert and oriented, and focus on facilitating their discharge home as requested, despite the significant physiological risks. Option B. Immediately involve the hospital's legal department and senior management to seek guidance on how to proceed, as the patient's refusal presents a complex ethical and legal challenge that requires immediate external intervention. Option C. Immediately administer the intravenous fluids and electrolytes, explaining to the patient that their condition requires urgent intervention for their own safety, overriding their refusal due to the perceived risk to their life. Option D. Engage in a detailed discussion with the patient to understand their concerns about the proposed treatment, explore the reasons behind their refusal, explain the potential physiological consequences of not receiving fluids and electrolytes, and discuss alternative strategies or less invasive options that might address their concerns while supporting their homeostasis. The correct answer is D. Engage in a detailed discussion with the patient to understand their concerns about the proposed treatment, explore the reasons behind their refusal, explain the potential physiological consequences of not receiving fluids and electrolytes, and discuss alternative strategies or less invasive options that might address their concerns while supporting their homeostasis. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the clinician's professional judgment regarding their physiological well-being. The core of the dilemma lies in balancing patient autonomy with the duty of care, particularly when a patient's decision-making capacity might be compromised by their condition, even if not formally declared as such. The principle of beneficence, acting in the patient's best interest, clashes with the principle of autonomy, respecting the patient's right to make their own decisions. The correct approach represents best professional practice by prioritizing a thorough assessment of the patient's capacity and understanding, coupled with open communication and exploration of alternatives. This aligns with the General Medical Council, GMC, guidelines on consent and decision-making, which emphasize that a patient has the right to refuse treatment, provided they have the capacity to do so. Clinicians must ensure that any refusal is informed and voluntary. If capacity is in doubt, a formal assessment is required. The correct approach involves seeking to understand the patient's reasoning, addressing their concerns, and exploring less invasive or alternative interventions that might achieve similar physiological goals while respecting their preferences. This upholds both ethical principles and regulatory requirements for patient-centered care. An incorrect approach that involves overriding the patient's wishes without a formal capacity assessment or adequate exploration of their concerns is a significant ethical and regulatory failure. It breaches the principle of autonomy and could be seen as a failure to obtain valid consent, potentially leading to a complaint of battery or assault. Forcing treatment without clear justification and due process undermines the trust essential in the doctor-patient relationship and contravenes GMC guidance on respecting patient choice. Another incorrect approach that involves immediately deferring to the patient's wishes without exploring the underlying physiological implications or potential harms also represents a failure in the duty of care. Respecting autonomy is crucial. It does not absolve the clinician from their responsibility to advise the patient about the risks and benefits of their choices, and to ensure they understand the potential consequences of their decisions, especially when homeostasis is threatened. This could be considered a failure of the principle of non-maleficence, do no harm, if the patient's refusal leads to significant harm that could have been reasonably prevented. A further incorrect approach that involves seeking immediate external intervention, such as involving legal teams or senior management, without first attempting to resolve the issue through direct communication, assessment, and de-escalation, is also professionally suboptimal. While escalation may be necessary in complex cases, it should not be the first resort when direct clinical and ethical reasoning can likely address the situation. This could be seen as an abdication of professional responsibility and an inefficient use of resources. The professional decision-making process for similar situations should involve a structured approach. 1. Assess the patient's current physiological state and the implications of their refusal on homeostasis. 2. Assess the patient's capacity to make this specific decision, considering their understanding, retention, use, and weighing of information, and their ability to communicate their decision. 3. If capacity is present, engage in open and honest communication, exploring the patient's rationale, fears, and values. 4. Provide clear, understandable information about the condition, the proposed treatment, alternatives, and the consequences of refusal. 5. Attempt to find a compromise or alternative that respects the patient's wishes while mitigating risks. 6. If capacity is in doubt, follow formal procedures for capacity assessment, and if necessary, seek best interest decisions involving family or carers where appropriate and legally permissible. 7. Document all assessments, discussions, and decisions meticulously. Question 8. To address the challenge of obtaining a comprehensive understanding of a patient's health status, which approach to gathering medical, social, and family history is most aligned with the principles of good medical practice as outlined by the General Medical Council, GMC. Option A. Rushing through the history-taking process to ensure all patients are seen within a strict time limit, asking only the most essential questions. Option B. Employing a structured questioning technique that systematically covers past medical conditions, current lifestyle factors, and relevant family health issues, while actively listening and allowing the patient ample opportunity to share information. Option C. Making assumptions about the patient's social background and family health based on their demographic information and appearance, and proceeding with the consultation accordingly. Option D. Focusing primarily on the immediate symptoms presented by the patient, and only asking about social or family history if directly related to the acute complaint. The correct answer is B. Employing a structured questioning technique that systematically covers past medical conditions, current lifestyle factors, and relevant family health issues, while actively listening and allowing the patient ample opportunity to share information. Explanation. This scenario presents a professional challenge because gathering a comprehensive patient history, especially medical, social, and family history, is fundamental to accurate diagnosis and effective treatment planning. The GMC's Good Medical Practice Guidelines emphasize the importance of taking a thorough history, respecting patient confidentiality, and communicating effectively. A patient's social history can reveal crucial factors influencing their health, such as lifestyle, support systems, and potential barriers to care. Family history can highlight genetic predispositions to certain conditions. Failing to gather this information comprehensively can lead to misdiagnosis, inappropriate treatment, and potentially harm to the patient. The correct approach represents best professional practice because it prioritizes patient well-being and adheres to ethical and regulatory standards. By actively listening, asking open-ended questions, and creating a safe space for the patient to share, the clinician demonstrates respect for the patient's autonomy and dignity. This approach aligns with the GMC's guidance on building trust and rapport, which are essential for effective doctor-patient relationships. It also ensures that all relevant information is obtained to make informed clinical decisions. An incorrect approach that focuses solely on the presenting complaint without exploring social or family history is professionally unacceptable. This would be a failure to meet the standards set out in GMC's good medical practice, specifically regarding the duty to provide good care. It could lead to overlooking significant contributing factors to the patient's illness, such as environmental exposures or inherited conditions, thereby compromising the quality of care. Another incorrect approach that involves making assumptions about the patient's social circumstances based on their appearance or other superficial factors is unethical and unprofessional. This demonstrates bias and a lack of respect for the individual, violating the principles of non-maleficence and beneficence. It also fails to gather accurate information, potentially leading to inappropriate advice or treatment. A further incorrect approach that involves rushing through the history-taking process or not allowing the patient sufficient time to respond would also be professionally unacceptable. This demonstrates a lack of empathy and can make the patient feel unheard or undervalued, damaging the doctor-patient relationship and potentially leading to incomplete or inaccurate information being provided. This contravenes the GMC's guidance on effective communication and the importance of a patient-centered approach. The professional decision-making process for similar situations should involve a systematic and empathetic approach to history-taking. This includes 1. Establishing rapport and a safe environment. 2. Using open-ended questions to encourage detailed responses. 3. Actively listening and observing nonverbal cues. 4. Systematically exploring medical, social, and family history, adapting the depth of inquiry based on the patient's presentation and concerns. 5. Ensuring confidentiality and respecting patient boundaries. 6. Summarizing and confirming understanding. Question 9. Cost-benefit analysis shows that a patient presenting with intermittent abdominal pain, bloating, and altered bowel habit, with no red flags for malignancy or inflammatory bowel disease, could have several gastrointestinal conditions. Considering the potential for significant patient morbidity and resource implications, which of the following initial management strategies is most aligned with best professional practice and regulatory guidance? Option A. Initiate empirical treatment for irritable bowel syndrome (IBS) with dietary advice and antispasmodic medication, while arranging for a colonoscopy to rule out other pathologies. Option B. Conduct a detailed symptom diary and trial of a low FODMAP diet under dietitian supervision, with a plan for further investigations if symptoms persist or worsen. Option C. Prescribe a broad-spectrum antibiotic and a proton pump inhibitor, PPI, empirically to cover for potential infections and acid-related disorders. Option D. Refer the patient for an urgent upper and lower gastrointestinal endoscopy to investigate all potential causes of their symptoms comprehensively. Correct answer is A. Initiate empirical treatment for irritable bowel syndrome (IBS) with dietary advice and antispasmodic medication, while arranging for a colonoscopy to rule out other pathologies. Explanation. This scenario presents a common challenge in clinical practice where a patient's symptoms, while suggestive of a specific gastrointestinal condition, also overlap with other potential diagnoses. A professional challenge lies in accurately diagnosing the underlying cause of the patient's symptoms to initiate appropriate and timely management, thereby optimizing patient outcomes and resource utilization. Careful judgment is required to differentiate between conditions with similar presentations, considering the patient's history, examination findings, and the potential benefits and harms of various diagnostic and therapeutic pathways. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based diagnostic process by considering the most likely diagnoses based on the clinical presentation and then proceeding with targeted investigations. It ensures that the patient receives the most appropriate care without unnecessary delay or exposure to potentially harmful or costly interventions. This aligns with the General Medical Council (GMC) guidance on good medical practice, which emphasizes the importance of accurate diagnosis, effective treatment, and patient safety. Specifically, it upholds the principles of beneficence and non-maleficence by aiming to provide benefit while minimizing harm. Furthermore, it reflects efficient resource management, a key consideration in the National Health Service (NHS). An incorrect approach involving immediate empirical treatment without a clear diagnosis poses several regulatory and ethical failures. Firstly, it risks masking the true underlying condition, potentially leading to delayed or incorrect definitive treatment and poorer patient outcomes. This contravenes the GMC's guidance on providing appropriate care and acting in the patient's best interest. Secondly, it may lead to the prescription of unnecessary medications, exposing the patient to potential side effects and contributing to antimicrobial resistance if antibiotics are used inappropriately. This is an ethical failure in terms of non-maleficence and responsible prescribing. Thirdly, it represents inefficient use of NHS resources, as investigations may still be required later and potentially ineffective treatments are administered. Another incorrect approach of ordering a broad range of investigations without a clear diagnostic hypothesis is also professionally unacceptable. While thoroughness is important, an unfocused approach can lead to diagnostic overshadowing, where incidental findings from numerous tests distract from the primary pathology. It also incurs significant costs and can lead to patient anxiety and potential iatrogenic harm from invasive procedures. This deviates from the principle of proportionality in healthcare, where interventions should be commensurate with the suspected condition. The professional reasoning process for similar situations should involve a structured approach. First, gather a comprehensive history and perform a thorough physical examination to formulate a differential diagnosis. Second, prioritize the differential diagnosis based on likelihood and severity. Third, consider the diagnostic yield and potential risks and benefits of further investigations for each prioritized diagnosis. Fourth, select the most appropriate investigations to confirm or refute the leading diagnosis. Fifth, initiate management based on the most likely diagnosis while awaiting definitive results, if clinically indicated and safe. Finally, regularly review the patient's progress and adjust the diagnostic and management plan as necessary. This iterative process ensures that patient care is dynamic and responsive to new information, adhering to ethical and regulatory standards. Question 10. The efficiency study reveals that a patient has suddenly collapsed and is unresponsive and not breathing normally. What is the most appropriate immediate next step in managing this critical situation, according to established UK medical guidelines for emergency care? Option A. Begin a detailed history taking from bystanders to understand the cause of collapse. Option B. Initiate airway management and artificial ventilation before chest compression. Option C. Administer intravenous fluids while assessing the patient's pulse. Option D. Immediately commence chest compressions and prepare for defibrillation if indicated. The correct answer is D. Immediately commence chest compressions and prepare for defibrillation if indicated. Explanation. This scenario presents a professionally challenging situation because it requires immediate, decisive action in a high-stakes environment where patient outcomes are directly impacted by the speed and accuracy of the medical response. The challenge lies in balancing the need for rapid intervention with the requirement to adhere to established protocols and maintain patient safety, all while potentially under significant pressure. Careful judgment is required to assess the situation, identify the most appropriate intervention, and execute it effectively. The correct approach represents best professional practice because it prioritizes the immediate and systematic application of established basic life support, BLS, and advanced cardiac life support, ACLS, guidelines. This adherence ensures a standardized, evidence-based response that maximizes the patient's chance of survival and recovery. Specifically, following the BLS survey, DRSAP, and then progressing to ACLS algorithms for cardiac arrest is mandated by professional bodies and is crucial for effective resuscitation. This approach is ethically sound as it upholds the duty of care to the patient and is legally defensible as it aligns with accepted medical standards of practice. An incorrect approach that involves delaying chest compressions to search for a reversible cause without first establishing an airway and ensuring adequate circulation would be a significant regulatory and ethical failure. This deviates from the fundamental principles of BLS, which prioritize immediate chest compressions to maintain blood flow to vital organs. Such a delay could lead to irreversible organ damage and a poorer prognosis, violating the principle of beneficence and potentially constituting negligence. Another incorrect approach, such as administering medications without confirming the rhythm or patient status according to ACL's protocols, represents a failure to follow established guidelines. This could lead to inappropriate or harmful interventions, such as administering a drug that is contraindicated for the specific cardiac rhythm, thereby causing harm and violating the principle of non-maleficence. It also demonstrates a lack of professional accountability and adherence to the standards expected of healthcare professionals. The professional reasoning process for similar situations should involve a rapid assessment of the patient's condition, immediate initiation of BLS, and then systematic progression through ACL's algorithms based on the patient's presentation and response. This involves continuous reassessment, clear communication with the team, and a commitment to evidence-based practice. Professionals must be proficient in recognizing life-threatening emergencies and applying the appropriate interventions without hesitation, while also being prepared to adapt their approach based on the evolving clinical picture. Question 11. Compliance review shows a patient has a documented history of a severe anaphylactic reaction to penicillin. The patient now requires treatment for a bacterial chest infection. Which of the following pharmacological approaches represents the most appropriate and safest management strategy? Option A. Prescribe a fluoroquinolone antibiotic, considering its broad spectrum of activity. Option B. Prescribe a different penicillin-based antibiotic, as the patient's reaction may have been a one-off event. Option C. Prescribe a macrolide antibiotic, ensuring it is appropriate for the specific bacterial pathogen identified. Option D. Prescribe a cephalosporin antibiotic, as cross-reactivity with penicillin is generally low. The correct answer is D. Prescribe a cephalosporin antibiotic, as cross-reactivity with penicillin is generally low. Explanation: scenario analysis. This scenario presents a common challenge in clinical practice where a prescriber needs to select an appropriate antibiotic for a patient with a known allergy. The challenge lies in balancing the need for effective treatment with the risk of a severe allergic reaction. Misjudgment can lead to patient harm, including anaphylaxis or ineffective treatment due to inappropriate drug selection. The prescriber must possess a thorough understanding of drug classes, cross-reactivity, and alternative treatment options, all within the framework of safe prescribing practices. Correct approach analysis. The correct approach involves identifying an antibiotic from a different class that is not known to have significant cross-reactivity with penicillin. This demonstrates a commitment to patient safety by avoiding a known allergen and adhering to best practice guidelines for managing drug allergies. It reflects an understanding of pharmacological principles, specifically the mechanisms of allergic reactions and the chemical structures of different antibiotic classes, which is crucial for safe prescribing. This approach aligns with the General Medical Council (GMC) guidance on good medical practice, which emphasizes acting in the best interests of patients and maintaining competence. Incorrect approaches analysis. Prescribing a cephalosporin without further investigation is a significant regulatory and ethical failure. While some cephalosporins have lower rates of cross-reactivity with penicillins compared to others, there is still a documented risk, particularly with first-generation cephalosporins. This approach fails to adequately mitigate the risk of a severe allergic reaction, potentially violating the duty of care owed to the patient. It demonstrates a lack of detailed pharmacological knowledge regarding antibiotic class sensitivities and cross-reactivity. Prescribing a macrolide without considering the patient's specific infection and the potential for resistance is also problematic. Macrolides are generally safe in penicillin-allergic patients. Their efficacy depends on the type of infection. Choosing a macrolide without confirming its suitability for the diagnosed condition could lead to treatment failure, which is a breach of professional responsibility. This approach prioritizes allergy avoidance over effective treatment, which is not always the optimal clinical decision. Prescribing a fluoroquinolone without considering potential side effects or contraindications is another failure. Fluoroquinolones have a distinct side effect profile, including tendon rupture and QT prolongation, which must be weighed against the benefits. While generally safe in penicillin-allergic patients, their use should be judicious and based on a comprehensive risk-benefit assessment, not solely on the absence of penicillin allergy. This approach overlooks the broader principles of rational drug therapy, professional reasoning. When faced with a patient allergy, the professional decision-making process should involve a systematic approach. 1. Confirm the allergy. Understand the nature of the reaction, e.g., rash, anaphylaxis, and its severity. 2. Identify the offending drug class, in this case penicillin. 3. Review alternative drug classes. Consider antibiotics from classes with minimal or no known cross-reactivity. 4. Assess the suitability of alternatives. Evaluate efficacy for the specific infection, potential side effects, contraindications, and local resistance patterns. 5. Select the safest and most effective option. Prioritize patient safety while ensuring adequate treatment. 6. Document the decision-making process. Record the rationale for drug selection, especially in the presence of allergies. Question 12. Consider a scenario where a 65-year-old gentleman presents to the emergency department with intermittent chest tightness, shortness of breath on exertion, and occasional palpitations. He has a history of hypertension and hyperlipidemia, both managed with medication. He denies any recent trauma or fever. His vital signs are stable, and his initial ECG shows nonspecific STT wave changes. What is the most appropriate next step in the management of this patient? Option A. Arrange for urgent cardiac catheterization to assess for coronary artery disease. Option B. Obtain a detailed cardiac history, perform a thorough physical examination, and consider further investigations such as a troponin assay and a chest X-ray based on the clinical assessment. Option C. Initiate empirical treatment for gastroesophageal reflux disease, GERD, given the chest tightness. Option D. Perform a comprehensive metabolic panel and complete blood count to rule out electrolyte imbalances and anemia. The correct answer is A. Arrange for urgent cardiac catheterization to assess for coronary artery disease. Explanation. Scenario analysis. This scenario presents a common challenge in clinical practice where a patient exhibits symptoms suggestive of a serious systemic pathology, specifically cardiovascular in nature, but the initial presentation is somewhat ambiguous. The professional challenge lies in the need for prompt and accurate diagnosis to initiate appropriate management, balancing the urgency of potential life-threatening conditions with the need to avoid unnecessary investigations and patient distress. The physician must apply systematic diagnostic reasoning, considering differential diagnoses and prioritizing investigations based on clinical suspicion and potential impact on patient outcomes. Correct approach analysis. The correct approach involves a structured and evidence-based diagnostic process. This begins with a thorough history and physical examination to gather comprehensive clinical data. Based on this initial assessment, the physician should formulate a differential diagnosis, listing potential causes for the patient's symptoms, with a particular focus on the most likely and most serious conditions. The next step is to select appropriate investigations that are targeted to confirm or refute these differential diagnoses, prioritizing those that will yield the most clinically significant information with the least risk and burden to the patient. This systematic approach aligns with the principles of good medical practice, emphasizing patient safety, clinical effectiveness, and resource stewardship, as expected within the UK regulatory framework for medical professionals. The General Medical Council, GMC, guidelines on good medical practice underscore the importance of accurate diagnosis and appropriate management. Incorrect approaches analysis. One incorrect approach would be to immediately proceed with highly invasive or broad-spectrum investigations without a clear diagnostic rationale derived from the initial clinical assessment. This could lead to unnecessary patient harm, anxiety, and significant resource expenditure, failing to adhere to the principle of proportionality in medical investigations. Ethically, this could be seen as a failure to act in the patient's best interest by exposing them to risks without sufficient justification. Another incorrect approach would be to dismiss the patient's symptoms as minor or psychosomatic without a thorough investigation, especially given the potential for serious underlying cardiovascular pathology. This could result in delayed diagnosis and treatment of a critical condition, leading to adverse patient outcomes and potentially breaching the duty of care owed to the patient. This would contraindicate the GMC's guidance on recognizing and responding to serious deterioration. A further incorrect approach might involve relying solely on a single investigation, without considering the broader clinical picture or the limitations of that specific test. This demonstrates a lack of comprehensive diagnostic thinking and could lead to misdiagnosis if the test is not definitive or if other contributing factors are overlooked. Professional reasoning. Professionals should adopt a systematic approach to diagnosis. This involves 1. Gathering comprehensive information history examination. 2. Developing a differential diagnosis, ranking possibilities by likelihood and severity. 3. Selecting investigations that are most likely to confirm or exclude key diagnoses efficiently and safely. 4. Reevaluating the diagnosis and management plan as new information becomes available. This iterative process ensures that patient care is evidence-based, safe, and effective, aligning with professional standards and regulatory expectations. Question 13. The investigation demonstrates a patient presenting with persistent fatigue, unexplained weight loss, and recurrent infections. Biochemical analysis reveals elevated levels of ketone bodies in the urine, alongside a significant decrease in blood glucose levels during fasting periods. Further testing shows impaired gluconeogenesis and a reduced capacity for fatty acid oxidation. Which of the following is the most likely primary metabolic derangement contributing to this patient's presentation? Option A. Impaired fatty acid synthesis. Option B. A deficiency in enzymes critical for the citric acid cycle. Option C. A defect in the regulation of glycogenolysis. Option D. A disorder affecting the breakdown of branched-chain amino acids. Correct answer is C. A defect in the regulation of glycogenolysis. Explanation. The investigation demonstrates a patient presenting with symptoms suggestive of metabolic derangement. The challenge lies in accurately identifying the underlying metabolic pathway affected and initiating appropriate management, which requires a thorough understanding of carbohydrate, protein, and lipid metabolism and their interconnections. Misinterpreting the metabolic profile can lead to delayed or incorrect treatment, potentially causing significant harm to the patient. The correct approach involves a systematic evaluation of the patient's clinical presentation in conjunction with relevant biochemical markers to pinpoint the specific metabolic pathway involved. This aligns with best professional practice as outlined by the General Medical Council (GMC) guidelines, which emphasize the importance of accurate diagnosis, evidence-based management, and patient safety. A comprehensive understanding of metabolic pathways allows for targeted investigations and interventions, ensuring the patient receives the most effective care. An incorrect approach might involve focusing solely on one macronutrient's metabolism without considering its interaction with others. For instance, attributing all symptoms to a carbohydrate issue while ignoring potential lipid abnormalities could lead to a misdiagnosis. This would be a failure to adhere to the GMC's guidance on maintaining an up-to-date knowledge base and applying it effectively to patient care. Another incorrect approach could be to initiate empirical treatment without a clear diagnostic pathway, which contravenes the principle of evidence-based medicine and could expose the patient to unnecessary risks or side effects. Furthermore, failing to consider the patient's overall metabolic state and focusing only on isolated biochemical values without integrating them into the clinical picture would be a breach of good medical practice. The professional decision-making process for similar situations should involve a structured approach. First, gather a comprehensive history and perform a thorough physical examination. Second, formulate a differential diagnosis based on the clinical presentation. Third, order appropriate investigations, considering the interconnectedness of metabolic pathways. Fourth, interpret the results in the context of the patient's overall condition. And finally, develop and implement a management plan that is evidence-based and tailored to the individual patient's needs, with ongoing monitoring and review. Question 14. Upon reviewing the biochemistry results of a 75-year-old patient admitted with confusion and dehydration, you note significantly elevated urea and creatinine levels, indicating acute kidney injury. The patient, when informed about the need for intravenous fluid resuscitation and potential dialysis, becomes agitated and repeatedly states, "I don't want any more tubes in me, just let me rest." You suspect the patient's refusal may be influenced by their current confused state and the discomfort of their illness. What is the most appropriate next step? Option A. Conduct a formal assessment of the patient's capacity to make decisions regarding their treatment. Option B. Discharge the patient home with oral rehydration salts as they are refusing further intervention. Option C. Proceed with intravenous fluid resuscitation immediately, as it is life-saving and the patient is clearly confused. Option D. Administer a sedative to calm the patient before re-explaining the treatment options. The correct answer is A. Conduct a formal assessment of the patient's capacity to make decisions regarding their treatment. Explanation. Scenario analysis. This scenario presents a professional challenge due to the conflict between a patient's expressed wishes and the clinician's understanding of best medical practice, particularly when the patient's capacity to make informed decisions is in question. The clinician must navigate the ethical principles of autonomy, beneficence, and non-maleficence, while adhering to the legal and professional standards governing medical practice in the UK, as expected for PLAB candidates. The core difficulty lies in determining if the patient's refusal of treatment is a valid exercise of autonomy or a consequence of impaired judgment, necessitating a careful assessment of capacity. Correct approach analysis. The correct approach involves a thorough and documented assessment of the patient's capacity to make decisions about their treatment. This aligns with the Mental Capacity Act 2005, which is the governing legislation in the UK for individuals who may lack the capacity to make decisions. Best professional practice dictates that a patient is presumed to have capacity unless proven otherwise. The assessment should determine if the patient understands the information relevant to the decision, can retain that information, can use or weigh that information as part of a decision-making process, and can communicate their decision. If capacity is confirmed, their wishes, even if contrary to medical advice, must be respected, provided the treatment is not life-saving and the patient is an adult. If capacity is lacking, the clinician must act in the patient's best interests, which may involve administering treatment against their wishes, but this requires a rigorous process and often involves consultation with others. Incorrect approach is analysis. One incorrect approach would be to immediately override the patient's wishes based solely on the clinician's opinion that the treatment is beneficial. This fails to respect patient autonomy and the presumption of capacity. It could be seen as a breach of the principles of good medical practice outlined by the General Medical Council, GMC, which emphasizes treating patients with respect and dignity and obtaining valid consent. Another incorrect approach would be to proceed with the treatment without any attempt to assess the patient's capacity, assuming their refusal is due to confusion or a lack of understanding that can be simply overcome by explanation. This bypasses the legal and ethical requirement to ascertain capacity and could lead to treating a competent individual against their will, which is a serious ethical and legal violation. A further incorrect approach would be to discharge the patient without further investigation or discussion, simply because they are refusing treatment. This could be seen as abandoning the patient and failing in the duty of care, especially if there are underlying biochemical issues that could be managed and improved with the proposed treatment, and if the patient's refusal is indeed a result of impaired capacity. Professional reasoning. Professionals facing such dilemmas should follow a structured decision-making process. First, gather all relevant clinical information, including the patient's current condition and the proposed treatment's rationale and risks/benefits. Second, engage in open and clear communication with the patient, explaining the condition and treatment options in an understandable manner. Third, assess the patient's capacity to make the decision, documenting the process and findings meticulously. If capacity is present, respect the patient's decision. If capacity is lacking, act in the patient's best interests, involving family or carers, where appropriate, and seeking further medical or ethical advice if necessary. Always prioritize patient safety and well-being within the legal and ethical framework. Question 15. The performance metrics show a slight increase in the incidence of cellular atypia noted on routine histological examination of tissue biopsies from a specific patient cohort. A clinician reviewing these reports is presented with findings that include increased nuclear size, irregular nuclear contours, and hyperchromasia in a subset of cells, alongside evidence of chronic inflammation and some degree of stromal fibrosis. Considering general pathology principles, which of the following interpretations and subsequent actions best reflects a responsible and evidence-based approach? Option A. Conclude that these findings are likely a reactive process due to chronic inflammation and that the cellular changes are benign adaptations, therefore no further action is required beyond routine monitoring. Option B. Recognize that cellular atypia, chronic inflammation, and fibrosis can be indicative of a persistent, low-grade pathological process that warrants further investigation to rule out premalignant or early malignant changes and consider additional diagnostic modalities or closer follow-up. Option C. Focus solely on the degree of fibrosis as the primary indicator of disease severity and disregard the cellular atypia and inflammatory components as secondary to the fibrotic changes. Option D. Immediately initiate aggressive treatment protocols, such as surgical resection or chemotherapy, based on the presence of cellular atypia, assuming the worst-case scenario without further diagnostic clarification. Correct answer is B. Recognize that cellular atypia, chronic inflammation, and fibrosis can be indicative of a persistent, low-grade pathological process that warrants further investigation to rule out premalignant or early malignant changes and consider additional diagnostic modalities or closer follow-up. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a clinician to interpret and act upon diagnostic findings that indicate a potentially serious underlying pathology. The challenge lies in distinguishing between a benign, self-limiting condition and a more sinister process that necessitates urgent intervention. This requires a thorough understanding of general pathology principles, including the morphology and clinical significance of cellular changes, inflammation, and tissue repair. Clinician must exercise careful judgment to avoid both undertreatment of a serious condition and overtreatment of a benign one, which could lead to patient harm and resource wastage. Correct approach analysis. The correct approach involves a systematic evaluation of the pathological findings in the context of the patient's clinical presentation. This includes considering the specific cellular changes observed, e.g., cellular hypertrophy, hyperplasia, metaplasia, dysplasia, neoplasia, the inflammatory response, acute VS, chronic, type of inflammatory cells, and evidence of tissue repair, fibrosis, regeneration. By correlating these pathological features with the patient's symptoms, signs, and relevant investigations, the clinician can formulate an accurate diagnosis and develop an appropriate management plan. This aligns with the GMC's Good Medical Practice Guidelines, which emphasize the importance of maintaining up-to-date knowledge and skills, making sound clinical judgments, and acting in the best interests of patients. Incorrect approaches analysis. One incorrect approach would be to dismiss the findings as insignificant without a thorough pathological assessment. This could lead to a failure to diagnose a serious condition, resulting in delayed treatment and potentially irreversible harm to the patient. This would be a breach of the duty of care and a failure to uphold professional standards. Another incorrect approach would be to immediately escalate to aggressive, invasive investigations or treatments based solely on a single, potentially misleading pathological feature, without considering the broader clinical picture or alternative benign explanations. This could lead to iatrogenic harm, unnecessary patient anxiety, and inefficient use of healthcare resources, contravening principles of evidence-based medicine and patient safety. A third incorrect approach would be to rely solely on the interpretation of a single pathologist without seeking further clarification or a second opinion if the findings are equivocal or do not fit the clinical picture. This demonstrates a lack of critical appraisal of diagnostic information and could perpetuate diagnostic errors. Professional reasoning. Professionals should approach such situations by first gathering all relevant clinical information. Then they should critically review the pathological report, considering the morphology, cellular changes, inflammatory patterns, and any evidence of tissue repair. This should be followed by a correlation of these findings with the clinical presentation. If there is any uncertainty or discrepancy, seeking clarification from the pathologist, consulting with colleagues, or requesting a second opinion are essential steps. The ultimate goal is to arrive at the most accurate diagnosis and implement the most appropriate and least harmful management plan for the patient, adhering to the principles of patient safety and evidence-based practice as outlined by the GMC. Question 16. Examination of the data shows a patient presenting with significant fatigue, nausea, and generalized edema. Laboratory results reveal a serum creatinine of 350 micromol/L, a blood urea nitrogen (BUN) of 25 mmol/L, a serum potassium of 6.2 mmol/L, and a serum bicarbonate of 18 mmol/L. The estimated glomerular filtration rate, eGFR, is calculated to be 15 ml/min/1, 73 m2, Which of the following represents the most appropriate initial interpretation of these findings regarding the patient's renal physiology? Option A. The edema is likely due to a primary cardiac issue, and renal function is only mildly affected. Option B. The low bicarbonate level indicates a primary metabolic alkalosis that needs correction with bicarbonate infusion. Option C. The primary issue appears to be isolated hyperkalemia, requiring immediate potassium-lowering agents. Option D. The data strongly suggests a significant impairment in the kidney's ability to filter waste products and regulate electrolyte and acid-base balance. The correct answer is D. The data strongly suggests a significant impairment in the kidney's ability to filter waste products and regulate electrolyte and acid-base balance. Explanation. This scenario presents a professionally challenging situation because it requires the clinician to interpret complex physiological data in the context of patient's acute presentation and make critical management decisions under pressure. The challenge lies in understanding the interplay of various renal functions and how their derangement impacts the patient's overall homeostasis, necessitating a thorough grasp of renal physiology beyond rote memorization. Careful clinical judgment is required to differentiate between compensatory mechanisms and pathological processes. The correct approach represents best professional practice because it demonstrates a systematic and evidence-based understanding of renal physiology and its clinical implications. By focusing on the GFR as a primary indicator of overall renal function, and then considering the implications of electrolyte and acid-base disturbances, the clinician is prioritizing the most critical aspects of renal health. This aligns with the General Medical Council (GMC) guidance on good medical practice, which emphasizes the need for doctors to maintain up-to-date knowledge and skills, and to use them to provide safe and effective care. Specifically, it reflects the principle of acting in the patient's best interest by addressing the most significant physiological derangements first. An incorrect approach that focuses solely on a single electrolyte imbalance without considering the broader picture of renal function would be professionally unacceptable. This would represent a failure to adopt a holistic view of the patient's condition, potentially leading to misdiagnosis or inappropriate treatment. Such an approach could violate the GMC's guidance on patient safety, as it risks overlooking critical underlying issues. For example, treating hyperkalemia without understanding its cause, e.g., impaired GFR, might mask a more serious problem and delay necessary interventions like dialysis. Another incorrect approach that prioritizes symptomatic relief over addressing the underlying physiological cause would also be ethically and professionally flawed. While symptom management is important, it should not supersede the investigation and treatment of the root cause. This could be seen as a failure to provide comprehensive care and could contravene the GMC's principles of providing effective treatment. For instance, administering diuretics to manage fluid overload without assessing the GFR and electrolyte balance could exacerbate renal dysfunction. A further incorrect approach that relies on anecdotal evidence or non-evidence-based practices would be a clear breach of professional standards. The GMC expects doctors to base their decision on the best available evidence. Relying on unverified information could lead to patient harm and would be a failure to uphold the standards of professional competence. The professional decision-making process for similar situations should involve a structured approach. First, a comprehensive assessment of the patient's clinical presentation and history. Second, a thorough review of relevant investigations, interpreting them within the context of the patient's overall condition. Third, consideration of the underlying physiological mechanisms at play, particularly focusing on key indicators of organ function like GFR. Fourth, formulation of a differential diagnosis and a management plan based on evidence-based guidelines and ethical principles. And finally, continuous monitoring and reassessment of the patient's response to treatment. Question 17. Performance analysis shows a 75-year-old male patient with moderate renal impairment, eGFR 40 ml/min/1. 73 m2 is being considered for a new antibiotic to treat a community-acquired pneumonia. He is currently taking several other regular medications. Which of the following actions demonstrates the most appropriate clinical judgment regarding pharmacokinetics and pharmacodynamics in this scenario? Option A. Choose an antibiotic with a well-established pharmacokinetic profile in renal impairment, consulting the British National Formulary, BNF, for specific dose adjustments and monitoring recommendations, and considering potential drug-drug interactions. Option B. Select an antibiotic known to be primarily renally excreted and reduce the standard dose based on general guidelines for moderate renal impairment, without consulting specific drug monographs. Option C. Prescribe a broad-spectrum antibiotic at the standard dose, advising the patient to report any new or worsening symptoms immediately, without further investigation into dose adjustments. Option D. Prescribe a standard dose of a commonly used antibiotic, assuming the patient's renal function will not significantly impact its efficacy or safety. The correct answer is D. Prescribe a standard dose of a commonly used antibiotic, assuming the patient's renal function will not significantly impact its efficacy or safety. Explanation: this scenario presents a common clinical challenge in the UK healthcare system, where a prescriber must make informed decisions about medication based on a patient's individual pharmacokinetic and pharmacodynamic profile. The challenge lies in balancing the need for effective treatment with the potential for adverse drug reactions, particularly in a patient with altered physiological parameters. Careful judgment is required to select the most appropriate drug and dosage regimen, ensuring patient safety and optimal therapeutic outcomes. In line with the General Medical Council (GMC) Guidance on Good Medical Practice and the Medicines and Healthcare Products Regulatory Agency (MHRA) regulations, the correct approach involves a thorough understanding of how the patient-specific condition, renal impairment, affects drug absorption, distribution, metabolism and excretion, pharmacokinetics, and how these changes might influence the drug's effect on the body, pharmacodynamics. This allows for a tailored prescription that accounts for potential drug accumulation or reduced efficacy, thereby minimizing risks and maximizing benefits. This aligns with the GMC's requirement for doctors to provide high-quality care, which includes prescribing safely and effectively and considering individual patient factors. An incorrect approach would be to prescribe a standard dose without considering the renal impairment. This could lead to drug accumulation, increasing the risk of toxicity, which is a failure to adhere to the principles of safe prescribing and patient care as mandated by the GMC. Another incorrect approach would be to arbitrarily reduce the dose without a clear understanding of the drug's pharmacokinetic profile in renal impairment, potentially leading to subtherapeutic levels and treatment failure. This demonstrates a lack of professional diligence and could contravene the MHRA emphasis on appropriate drug use. Finally, ignoring the patient's reported symptoms and proceeding with a standard regimen without investigating the potential link to the medication would be a failure to adequately assess and manage the patient's condition, breaching the duty of care. Professionals should employ a systematic decision-making process. First, assess the patient's clinical status and relevant physiological parameters, e.g., renal function. Second, identify potential drug-related issues based on the patient's condition and current medications. Third, consult reliable drug information resources, e.g., the British National Formulary (BNF), for specific guidance on dose adjustments in renal impairment. Fourth, select the most appropriate drug and dosage regimen, considering individual patient factors and potential risks and benefits. Finally, monitor the patient's response and adjust the treatment as necessary. Question 18. The risk matrix shows a moderate likelihood of a significant adverse event if a specific biochemical marker is left unaddressed in a patient with multiple chronic conditions and a history of recent hospital discharge. The marker is elevated, but the patient is currently asymptomatic and stable. Which of the following represents the most appropriate next step in patient management? Option A. Schedule a follow-up appointment to reevaluate the patient clinically and repeat the specific biochemical marker within a defined time frame, considering the patient's overall clinical picture. Option B. Refer the patient for an urgent, invasive diagnostic procedure to definitively identify the cause of the elevated marker, irrespective of current symptoms. Option C. Immediately initiate a broad-spectrum antibiotic course to address any potential underlying infection contributing to the biochemical abnormality. Option D. Advise the patient to ignore the result and focus on their existing treatment plan, as they are currently asymptomatic. The correct answer is A. Schedule a follow-up appointment to reevaluate the patient clinically and repeat the specific biochemical marker within a defined time frame, considering the patient's overall clinical picture. Explanation: This scenario presents a professional challenge due to the potential for misinterpretation of laboratory results in a patient with complex comorbidities, impacting clinical decision-making and patient safety. The physician must balance the need for timely intervention with the understanding that isolated biochemical abnormalities may not always reflect the immediate clinical picture, especially when other factors are at play. Careful judgment is required to avoid unnecessary investigations or treatments that could harm the patient or incur significant costs. The correct approach represents best professional practice by prioritizing a holistic patient assessment. It acknowledges that laboratory results are one piece of the diagnostic puzzle and must be interpreted in the context of the patient's overall clinical presentation, history, and other investigations. This aligns with the General Medical Council, GMC, guidance on good medical practice, which emphasizes the importance of treating patients as individuals and making decisions based on their best interests. Specifically, it upholds the principle of acting with honesty and integrity, ensuring that investigations and treatments are evidence-based and proportionate. An incorrect approach that immediately escalates management based solely on a single elevated biochemical marker without considering the clinical context is professionally unacceptable. This could lead to iatrogenic harm, such as adverse drug reactions or complications from invasive procedures, violating the GMC's principle of providing a high standard of care. It also fails to demonstrate effective communication and collaboration with the patient, as it bypasses a thorough discussion of the findings and potential management options. Furthermore, it may represent a failure to use resources efficiently, a key aspect of professional responsibility. Another incorrect approach, which involves delaying further action indefinitely without reevaluation, is also professionally unsound. While avoiding over-investigation is important, complete inaction in the face of potentially significant findings, even if not immediately critical, can lead to delayed diagnosis and treatment of underlying conditions. This could breach the duty of care owed to the patient. The professional decision-making process for similar situations should involve a systematic approach. 1. Review the laboratory result in conjunction with the patient's current clinical status, including symptoms, signs, and vital signs. 2. Consider the patient's past medical history, current medications, and known comorbidities, as these can influence biochemical parameters. 3. Evaluate the magnitude and trend of the biochemical abnormality. Is it a minor deviation or a significant elevation/depression? Has it changed over time? 4. Consult relevant clinical guidelines or specialist advice if the result is unexpected or difficult to interpret in the clinical context. 5. Formulate a differential diagnosis for the biochemical abnormality. 6. Plan further investigations or management based on the integrated assessment of all available information, prioritizing patient safety and benefit. 7. Communicate findings and management plans clearly with the patient. Question 19. Analysis of a patient with newly diagnosed hypertension who expresses a strong desire to avoid all prescribed medication due to a fear of side effects, despite clear evidence that their blood pressure requires pharmacological intervention to prevent significant cardiovascular events. The clinician has explained the risks of untreated hypertension and the benefits of medication in understandable terms. What is the most appropriate course of action for the clinician in this ethically challenging situation, adhering strictly to UK medical regulations and GMC guidelines? Option A. Dismiss the patient's fears as unfounded and insist that they take the medication as prescribed, threatening to withdraw care if they refuse. Option B. Accept the patient's refusal of medication without further exploration, documenting their decision, and discharging them from further cardiovascular care. Option C. Administer the prescribed antihypertensive medication without further discussion, as the clinician has determined it is in the patient's best medical interest to prevent serious cardiovascular complications. Option D. Continue to engage in a detailed discussion with the patient, exploring their specific fears and concerns about medication, offering to start with a low dose or alternative medication if appropriate, and reiterating the importance of managing their hypertension, while ultimately respecting their informed decision if they retain capacity. The correct answer is D. Continue to engage in a detailed discussion with the patient, exploring their specific fears and concerns about medication, offering to start with a low dose or alternative medication if appropriate, and reiterating the importance of managing their hypertension, while ultimately respecting their informed decision if they retain capacity. Explanation. Scenario analysis. This scenario presents a professional challenge due to the conflict between a patient's expressed wishes and the clinician's assessment of their best interests, particularly when those wishes might lead to significant harm. The patient's desire to avoid medication, despite a clear diagnosis of a condition requiring it for cardiovascular health, necessitates a delicate balance between respecting autonomy and fulfilling the duty of care. The clinician must navigate this ethically complex situation, considering the patient's capacity to make informed decisions and the potential consequences of non-adherence to treatment. Correct approach analysis. The correct approach involves a thorough assessment of the patient's capacity to understand their condition, the proposed treatment, and the risks and benefits of both accepting and refusing treatment. This aligns with the General Medical Council (GMC) guidelines on consent and decision-making, which emphasize the importance of ensuring patients are fully informed and have the mental capacity to make decisions about their health care. The clinician should engage in a detailed discussion, exploring the patient's reasons for refusal, addressing their concerns, and providing clear, understandable information about their cardiovascular condition and the necessity of medication. If the patient has capacity, their decision must be respected, even if it is not what the clinician believes is best. The focus is on shared decision-making and empowering the patient to make an informed choice. Incorrect approaches analysis. One incorrect approach would be to override the patient's wishes and administer medication against their will, even if the clinician believes it is for their own good. This would be a direct violation of the GMC's principles on consent and patient autonomy, constituting a failure to respect the patient's right to make decisions about their own body and treatment. Such an action could lead to a complaint of assault or battery. Another incorrect approach would be to simply accept the patient's refusal without further exploration or assessment of their capacity. This would represent a failure in the clinician's duty of care. The GMC expects doctors to take reasonable steps to ensure patients understand their condition and treatment options. Abandoning the patient's care due to their refusal without attempting to understand and address their concerns is professionally negligent. A third incorrect approach would be to dismiss the patient's concerns as irrational without attempting to understand their underlying reasons. This demonstrates a lack of empathy and a failure to engage in a therapeutic relationship. The clinician has a responsibility to explore the patient's beliefs and fears, which may be rooted in past experiences or misinformation, and to address them constructively. Professional reasoning. In situations involving patient refusal of necessary treatment, professionals should follow a structured decision-making process. First, assess the patient's capacity to make the decision. This involves ensuring they can understand the information, retain it, use it to weigh options, and communicate their decision. Second, if capacity is present, engage in a comprehensive discussion to explore the patient's understanding, concerns, and reasons for refusal. Provide clear, jargon-free information about the condition, treatment options, and potential consequences of each. Third, explore alternatives or modifications to the proposed treatment that might be more acceptable to the patient, while still addressing their cardiovascular needs. Fourth, document the entire process meticulously, including the capacity assessment, discussions held, information provided, and the patient's final decision. If capacity is lacking, follow established procedures for making decisions in the patient's best interests, involving family or legal guardians where appropriate. Question 20. Benchmark analysis indicates that a patient with newly diagnosed type 2 diabetes mellitus expresses significant anxiety about starting insulin therapy, stating they have read online that it will damage their kidneys faster, and they would prefer to wait and see if diet and exercise alone can manage their blood glucose levels. The patient is otherwise well informed about their diet and exercise plan. Which of the following represents the most appropriate initial approach for the clinician? Option A. Reassure the patient that their concerns are unfounded and that insulin is a safe and effective treatment, then proceed with prescribing insulin as per standard guidelines, as delaying treatment could lead to irreversible kidney damage. Option B. Acknowledge the patient's concerns about kidney damage but firmly state that their reading is incorrect and that delaying insulin will inevitably lead to worse outcomes, then insist on starting insulin immediately. Option C. Suggest the patient research further from reputable medical sources to understand the benefits of insulin and the risks of uncontrolled diabetes, and then schedule a follow-up appointment to discuss their findings. Option D. Gently explain the physiological mechanisms by which insulin helps regulate blood glucose, thereby protecting organs like the kidneys from long-term damage, and discuss the evidence supporting its use in preventing diabetic complications, while also acknowledging their preference to try lifestyle changes first and agreeing to closely monitor their progress. The correct answer is D. Gently explain the physiological mechanisms by which insulin helps regulate blood glucose, thereby protecting organs like the kidneys from long-term damage, and discuss the evidence supporting its use in preventing diabetic complications, while also acknowledging their preference to try lifestyle changes first and agreeing to closely monitor their progress. Explanation: this scenario presents a professional challenge due to the need to balance a patient's expressed wishes with the clinician's understanding of best medical practice, particularly when those wishes might stem from misinformation or a misunderstanding of physiological processes. The clinician must navigate the ethical imperative to respect patient autonomy while upholding their duty of care and ensuring patient safety, all within the framework of GMC guidance on consent and the professional responsibilities of a doctor in the UK. The correct approach represents best professional practice because it prioritizes clear, empathetic communication and shared decision-making. It involves a thorough assessment of the patient's understanding, addressing their concerns directly, and providing accurate, evidence-based information about their condition and treatment options. This aligns with GMC guidance on consent, which emphasizes that consent must be voluntary, informed, and given by a patient with the capacity to make the decision. By explaining the physiological rationale behind the recommended treatment, the clinician empowers the patient to make an informed choice, fostering trust and adherence. An incorrect approach that involves dismissing the patient's concerns or overriding their wishes without a thorough capacity assessment would be a significant ethical and regulatory failure. This would contravene the principles of patient autonomy and informed consent, potentially leading to a breakdown in the doctor-patient relationship and a breach of GMC guidelines. Similarly, proceeding with a treatment plan that the patient has explicitly refused, even if the clinician believes it is in their best interest, without a formal capacity assessment and a clear legal or ethical justification, e.g., emergency life-saving treatment where capacity is absent, would be professionally unacceptable and could lead to disciplinary action. Another incorrect approach might be to simply state the medical facts without acknowledging or addressing the patient's underlying anxieties or beliefs, which fails to build rapport and can lead to the patient feeling unheard and disrespected, undermining the therapeutic alliance. The professional reasoning process in such situations should involve 1. Actively listening to and acknowledging the patient's concerns and beliefs. 2. Assessing the patient's understanding of their condition and the proposed treatment, including the physiological basis. 3. Providing clear, jargon-free explanations tailored to the patient's level of understanding, addressing any misconceptions. 4. Exploring the patient's values and preferences. 5. If capacity is in doubt, undertaking a formal capacity assessment according to established legal and ethical frameworks. 6. Documenting the discussion, the patient decision, and the rationale for both. 7. Seeking senior or specialist input if the situation is complex or uncertain.